So I'm Michael Cantor, and I'm from New York University School of Medicine.
And what do you do for
So at NYU, I'm at the Director of Clinical Research Informatics there, and I'm a associate professor in the Department of Population Health and Medicine. My background is in biomedical informatics. I'm an internist. I used to work at Pfizer before I went to NYU. I got to NYU about 3 months ago. I was at Pfizer for 6 years. And before Pfizer, I was at NYU before then too, and I mainly worked at Bellevue Hospital, where I ran the electronic medical record systems there.
That's great. So you were just on a panel,
right?
And what was that panel about?
Yeah, so our panel was called Putting the Patient First and Last, and it was about personalized medicine for patients. So we started out, one of the panelists talked about speeding up clinical trials. I talked about how you actually, once you've actually got these discoveries, how do you get them into the clinic. The next speaker spoke about some of the work that they're doing at Columbia around cancer and personalized medicine. And the last speaker talked about Transmart, which is an informatics platform that allows you to do collaborative work. And I think the takeaway overall from the panel, it was good because it gave you kind of the broad spectrum, starting from the basic science up to collaboration. And I would say that, first of all, there's still a lot of work to be done, but there's a lot of tools out there that you can use to make developing therapies a lot easier. And we just have to have the right questions to ask, know how to use those tools correctly, and probably really collaborate more than we are currently, because the more data that you have, it's the more questions you're able to answer, and the more work you're able to get done to help out patients. For me specifically, I talked about, once you've got these discoveries out in the field, how do you actually get them into the clinic, and some of the challenges there on different types of patient populations, because you have my patients, when I used to work at Bellevue, for example, a lot of them didn't speak English, they didn't have insurance, they just wanted me to tell them what to do. Now I'm over at NYU in private practice again, and I have patients who are a lot more independent minded and actually want to do a lot more of shared decision making, and often have their own opinions about what they want to do because they've done research on their own. And so you have to balance out, you might have this great new therapy, but for some people, they want to understand what they're taking before they take it, and they want to know about the side effects, and they want to do a lot of research, and they have the resources to do additional testing, whereas some people just want you to tell them what to do, and they don't really care about the other stuff. So balancing that, once you get these discoveries, getting them actually out into practice, it's a very different thing. So, but yeah, I think that was the takeaway from, at least from my part of the talk.
Great. Any next steps on that? Do you think they should be going in the future? Any direction with that?
Yeah, well, I think there's a lot of efforts. There's a lot of efforts on the government side to allow us to share data more effectively around comparative effectiveness. There's a lot of private initiatives like Robert from Janssen was talking about. So around Transmart, a lot of the pharma industry it uses Transmart now, so it's a platform that we can use to do more collaborative work. And I think that's really the key, finding out, we have the technologies to share the data, but the big issue is incentives, so why do I want to share my data with you? You might take credit for it, you might get the publication, you might get the bonus, so figuring out ways to incentivize people and reward people for data sharing, I think is probably the way to get this going.